Blog Talk Radio.
Good morning. This is Dr. Mark Snow with the Head, Neck, and Back Pain Relief Center of West Valley in West Valley City, Utah. Chiropractic physician and author of the book Sick World, The Story of Modern Day Slavery, available on Amazon.com. So this morning we're going to be talking about various health topics. We'll be talking about some nutritional things, carbohydrates. We'll be talking about milk. We're going to be covering some other things such as obesity, talking about neurofeedback therapy. But before we get into the show, we have a quick message from our sponsor.
Auto accident? Contact the Utah Whiplash Group, certified specialist physicians, attorneys, and massage therapists. UtahWhiplash.com. And
we're back. So a article in the Lancet Respiratory Medicine published in April 2014. A new report reveals that 1/3 of patients experience depression after leaving intensive care. Researchers note that this depression typically expressed itself as physical rather than psychological symptoms such as weakness, appetite change, and fatigue. Study leader Dr. James Jackson explains the physical symptoms of depression are often resistant to standard treatment with antidepressant drugs, and we need to determine how best to enhance recovery with a new focus on physical and occupational rehabilitation. This is something that I see all the time as a chiropractic physician treating people physically. We see all kinds of problems with depression. People have pain, aches and pains and soreness, and a lot of times it is because of depression. Now there's a treatment modality that we use called brain core neurofeedback therapy. What happens with individuals who are suffering from depression is often there is a dysregulation of brain waves. The brain produces 4 wavelengths, and they are associated with different states of arousal. So different wavelengths have different frequencies. There's slower frequencies and faster frequencies, and a healthy, regulated brain will shift back and forth between these frequencies depending on the demand of the situation that the individual's in at the time. What we find is that there are dysregulations that occur because of trauma, because of chemical toxicity, because of emotional stress. There's different things that can cause these dysregulations. And so what we do with neurofeedback therapy is we actually train the brain to produce regulated brain waves so that the individual can function through those different wavelengths depending on the situation. Very effective treatment, non-invasive, non-drug treatment for individuals suffering with depression, which then helps to alleviate some of these symptoms. All right, another article, Journal Environmental Science and Technology. This is published in February 2014. This is an interesting one. Experts warn that urinating in a swimming pool can pose a serious health risk. And now there's a shocker, huh? Researchers have found that uric acid in urine can generate volatile disinfection byproducts in the pool when it interacts with chlorine. The toxic compounds of concern are Cyogens chloride and trichloramine. Inhalation of Cyogens chloride can negatively affect the cardiovascular system, the pulmonary system, the central nervous system, and can potentially be fatal. Trichloramine is a compound linked to acute lung injury through exposure to chlorine-based disinfectants. So, let's not pee in the pool, huh? That's kind of common sense not to do that where everybody's swimming, but here's just a little more information about health risks associated with that. All right, moving on now to a study out of Butler University. This was published in January 2010. Overtraining occurs when you do not allow your body to adjust, adapt, and recuperate from the training regime you take part in, and can be detrimental to realizing your fitness goals. Signs of overtraining. Now, this is really key here. It's important to let your body rest and recuperate between training sessions. But what I find interesting is the signs of overtraining, which include decreased performance, increased resting heart rate and blood pressure, increased muscle fatigue, gastrointestinal problems, depression, irritability, apathy, which is the feeling of not caring, and low self-esteem. Now, those symptoms of overtraining are very similar, sometimes some of them exactly the same, as symptoms of obesity. Experts recommend starting slowly with your exercise routine and working with a trainer to assess your fitness level and determine a more personalized training program. So it's important to rest, but that doesn't mean take a year off and say, hey, I'm resting up. No, it's important to train sensibly and let your body rest. But make sure you are exercising. Now, here's a study that was published in the Journal of Pediatric, Maternal, and Family Health, November of 2013. A 4-year-old child with type 1 diabetes was able to better control her blood sugar after undergoing 2 months of chiropractic care. The patient's hemoglobin A1C decreased from 7.2% to 6.5%, and her insulin use decreased from 15 units to 11 units per day. This case study supports the optimizing effects of chiropractic care on function throughout the body. Often people just discount chiropractic as just back pain care. Now, certainly chiropractors treat back pain, and their method of treatment is primarily manipulation of the joints of the spine. Where the disconnect takes place, where people don't understand the effect that has on the body, is they fail to recognize that the spine, the vertebrae, 24 movable joints surround the spinal cord, which is part of the central nervous system, which is the highway of information from the brain to the body and from the body to the brain. From that spinal cord exit nerves, and those nerves exit through small openings between vertebrae in the spine, and they go out to all the different organs, tissues, and cells of the body. This way, the brain communicates with the body, and the body with the brain, and everything's regulated. Well, what happens when there are fixations, joints that don't move properly, joints that are misaligned, there's inflammation around those nerves, that can interfere with the information getting from the brain to the body, from the body to the brain. It interferes with that interaction, and it causes organs to not function as well, whatever organs those nerves go to. So by adjusting the spine, taking those motions in the spine and relieving that pressure on those nerves and restoring that communication between the central nervous system and the body can function better. All right, moving on now to a study out of the American Journal of Public Health, April 2013. Scientists from the Boston University School of Medicine and Boston University School of Public Health, now this is really an important study, report that alcohol consumption leads to about 1 in 28.6 cancer deaths in the United States. So out of every 28.5 people who die from cancer, one of those, the cancer was caused by alcohol. 15% of all breast cancer deaths caused by alcohol. Although heavy drinking is linked to the greatest risk for alcohol-related cancer death, even 1.5 drinks per day or less accounts for nearly 30% of all alcohol-related cancer fatalities. So here's an argument for those who say, it's important to drink a little bit of wine with your meal in the evening to help your cardiovascular health. Well, actually, and I reported on this, I think on my last program, that the studies actually don't support that. The studies actually show that in order for you to get the cardiovascular benefit from drinking wine, you'd have to be a raging alcoholic to drink enough alcohol, to drink enough wine to get the benefit. And now we have this study here that shows that even 1.5 drinks per day accounts for nearly 30% of all alcohol-related cancer fatalities. Lead study author Dr. Timothy Naimi adds, the relationship between alcohol and cancer is strong, but is not widely appreciated by the public and remains underemphasized even by physicians. Alcohol is a big preventable cancer risk factor that has been hiding in plain sight. And that's a quote from Dr. Naimi. Now here's an interesting nutritional article. This is in Food and Nutrition Science, April 2014, so just last month. Consumers can improve their diet by enjoying white or brown rice in their daily meals. According to new research by scientists at Baylor College of Medicine in Houston, lead author Dr. Teresa Nicholas states, quote, our results show that adults who eat rice had diets more consistent with what is recommended in the U.S. dietary guidelines, and they showed higher amounts of potassium, magnesium, iron, folate, and fiber while eating less saturated fat and added sugars. Eating rice is also associated with eating more servings of fruit, vegetables, meat, and beans. So, now this is interesting that this study just came out in April of 2014. Let me turn now to a book that I read 12 years ago. This book is entitled Mega Health, which was written by Dr. Mark Sorensen. And in his book, Mega Health, I'm turning to pages 28 and 29. He says he's talking about the importance of rice in the diet, and he talks about he compares American diet with the Chinese diet. He says Chinese eat 77% of their calories from starch, not fat. I mean, he was contrasting that with the American diet being high in fat, and he states a high starch, low-fat eating plan is as essential to the prevention and treatment of obesity as it is to the prevention and treatment of diabetes, osteoporosis, cancer, heart disease, kidney disease, gallbladder disease, and others. It is not the number of calories nor the amount of food consumed which is important. It is the type of food that is the prime factor in causing obesity. So, eating healthy, a lot of times, people get so confused about that, and they get so just tied up about how to eat healthy. And I see people all the time walking out of grocery stores with bags of things that they think are healthy, that are really simple carbohydrates that have fat, because they're marketed as healthy. And we really have to understand that not everything that's marketed as healthy is healthy. But eating healthy is not complicated. It doesn't have to be complicated. We don't have to be gourmet chefs in order to eat healthy. Just a simple bowl of rice and a mango is a healthy meal, and gives you lots of nutrients. In fact, the completeness factor of that meal is nearly 100% in terms of nutritional value. So real quick, I've only got about a minute left. I want to go into one more study. Well, actually, I'm going to save that for the next show because I don't have time, and we're going to be talking about milk. We've got about 60 seconds here. Again, this is Dr. Mark Snow with the Head, Neck, and Back Pain Relief Center in West Valley City, Utah. Chiropractic physician, author of the book Sick World, A Story of Modern-Day Slavery. This book is available on Amazon.com in ebook format, hardback, and paperback. If you're in the Utah area and purchase the book and would like to come by and have it signed, I'd be happy to do so. You can find us at 3536 South, 5600 West in West Valley City, Utah. Suite number 3. A quote to close out the show by Winston Churchill. What is the use of living if it be not to strive for noble causes and to make this muddled world a better place for those who will live in it after we are gone? Have a wonderful day. Thank you for joining me.